Today's Health Watch. Once again, we're talking to Dr. Syed Hussein from Trinity Health of New England about influenza and the flu shot, something we can't talk about enough. But quickly, I just want to talk about West Nile virus. First of all, Doctor, good morning. Good to see you again, sir.
Morning, likewise.
Yeah, glad to have you here. West Nile virus gets a lot of media coverage for a relatively small number of cases, almost minuscule. That being said, I was surprised to find out, I guess technically it is still West Nile season, huh?
It is. Per the CDC, the season starts in summer, Tim, and lasts till fall.
Yeah.
So we're still in fall. We're still going to have some, hopefully, warmer days where people will venture out. So it's common sense precautions that folks need to take, including making sure that you're using a credible, approved insect repellent, making sure you cover your arms and legs when you're out and about, especially where there might be mosquitoes.
Yes.
And it's a mosquito-driven disease where this virus, in most people, though, 8 out of 10 people, it wouldn't cause any symptoms.
Yeah, you wouldn't
It's only
even know.
a small minority of people, 1 out of 150, actually, that may develop some severe symptoms, which include high fever, stiffness, neck stiffness, and disorientation. If you have any of those symptoms, please seek medical attention.
I feel like that variability in symptoms is something people are starting to get more familiar with, because that's really where we are with COVID. Some people, you get nothing. Some people wind up dying. The flu seems to be less lethal, but boy, when it hits you, you certainly really know. And it looks like we might be in for a bit of a bad season. Do we have any update on how we're doing with flu shot protection and progression of the flu in Connecticut?
Yeah, we continue educating folks that they need to roll up their sleeves, get the flu shot now. Yeah. Especially our seniors and children are more vulnerable based on data coming in from the Southern Hemisphere, namely Australia, which actually is emerging from their worst flu season in over 5 years.
Yeah, people over 65. They need a special type of the flu shot. What is it, and how do you go about getting it?
They do. They need to ask for this. There are 3 vaccines for the flu that are approved for this age group above the age of 65 because they're more vulnerable, Tim. And they need to make sure that they ask either in your doctor's office or your pharmacy that please give me that high-dose vaccine. And the premise here is that the immune system is a little bit slower, weaker in this age group, so there's more antigen, more dosage of vaccine itself that's given in order for a more robust immune response.
People over 65, that's one at-risk group. Young children is another. I think we've talked about this before, that for a certain group, so long as it's your first shot and you're under a certain age, you need 2 doses. Why is that?
Yeah, age under the age of 9, because they've not really been exposed, and more so over the last couple of years, we've seen children definitely don't have any kind of natural immunity built onto these viruses because of all the public health measures that were in place and the protection that this provided.
Yeah. This is what I really want to ask about. Flu shot is still a more traditionally derived shot. What does the future of flu shots look like? Are we going to get mRNA technology like we have for the COVID shots and get them into flu shots?
Yeah, that's a great question. It's exciting because there are 2 very large studies being conducted right now as we speak. Phase 3 trials by both Pfizer and Moderna. Pfizer had 25,000 people are enrolled, and Moderna has 6,000.
Yep.
And so it would be a more accurate, more reliable vaccine compared to the decades-old technology that we currently deploy and use. And it would enable us, Tim, to be able to tweak the vaccine depending on which strains are most prevalent in flu season. Sometimes that varies. When flu season starts, it may be something else, and then towards the end, we may see a different strain pop up. So the messenger RNA technology enables us to make those changes quickly.
Is that why it would be more accurate, because there's a faster turnaround to get it done?
Not necessarily. It's also because it's able to capture the genetic material that is present in the virus that we're looking at more reliably and more accurately.
Is it able to turn around more quickly, though, so you can you don't have to do as much guesswork as to what strains are the biggest ones?
That's right.
Ah, that's wonderful. See, there you go. So maybe the flu won't be quite the pest that it has been, although it looks like, once again, we might be in for the worst flu season in at least 5 years. So go out, get that flu shot if you haven't done it yet. Doctor, thank you so much for taking the time, as he does every Wednesday as part of our Health Watch. Dr. Syed Hussein from Trinity Health of New England. Okay, let's get over